This is his own omnipotence. This is his own grandiosity, because in his mind, if you tease this apart and you get really close to it, which is what I always recommend doing when you're trying to relate to somebody like this in your life, my guess is what you would begin to hear is there's a whole fantasy that goes on, and how special or how different, how talented, how intelligent he feels, and how he feels so above everybody at school because he's so special. Hello, everyone. Welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. In our previous episode, we delved into the topic of what's known as white depression. That's basically when somebody has a lack of motivation in life. And we went back to this episode because some questions came in from a listener who joined us on the previous episode. That was Jim. And he was discussing his relationship with his daughter and how he was responding to her. So in keeping with our commitment to listener engagement, I'm very excited to have another listener with us today, Celeste. Celeste is a psychology student, and she herself, like Jim, has posed some really insightful questions, not about the same topic. This is not about a lack of motivation, but she listened to an earlier episode on why we think in extremes. And the same thing as I did with Jim, rather than engaging with Celeste through an email exchange, I invited her to come on to the podcast because I think the questions that she's raising about, in essence, what we call splitting, that's when we think in extremes. I think everybody can probably benefit from her questions, and including myself, of course. So she kindly agreed to join us for today's discussion. I'd like to welcome her to the show. And maybe, Celeste, you could start by telling us a little bit about what was it? The episode was actually called, Why Do I Think and Act in Such Extremes? And for anybody who wants to go back and listen to that, that's episode 14. And I was wondering if you could start us off in terms of what piqued your curiosity, or what sort of lingering questions, or did it spark your interest in something else? So I'll just turn it over to Celeste now, and then we'll jump into that episode and her questions.
Yes, thank you. Yeah, so I was listening to, as mentioned previously, the Acting and Thinking in Extremes podcast episode, and it reminded me of someone that I'm working with currently for my psychological studies. In that episode, there was an example of someone who kind of felt disconnected in multiple facets of their life with black and white thinking, not being able to fully kind of process their feelings and emotions when it comes to like thinking in extremes.
Yeah.
So I have someone that I'm working with under the alias of Tony, and in this specific example, this person is struggling with having confidence and security and fitting in. He doesn't exactly feel like he truly belongs in any environment within his life.
Okay, so if I may, before we get into the details of sort of the question about this case that you're thinking about, I just want to maybe do a quick review. I'm not going into any sort of depth, but let's go back and think about episode 14 just for a moment to orient the listeners of the podcast in terms of what we're thinking about when I act in extremes. So the example I think I gave in that episode was of a woman who was working overtime, like really working to the point of burnout. But then the problem was when she stopped working because she got burnt out, she was getting in her head and was really overwhelmed, I guess, with the thoughts that were coming up. And the position that I took in that episode, and this is really important to note, is in many of the episodes, you could take any concept like splitting. Splitting is actually thinking in extremes, right? It's either black or white, all or none. You're either with me or you're against me. But the way we conceptualize splitting, or why somebody, sometimes I hear this, they had a split, they say, the way we conceptualize it really depends on the theoretical perspective to which we prescribe. So if we subscribe to a theory on splitting, like I did in this particular episode that Celeste, you're thinking about, the way that I described it was with this woman or anybody who's working overtime, what happens is this could be used defensively, meaning if you're so busy and you fill up your mind with work, and by the way, this could be with alcohol, this could be with smoking or drugs, this could be with sexual addictions, you split off. There comes that word, splitting, right? You split off other thoughts and feelings that you then don't really need to deal with, right? Because you're so busy. But the problem with that is when you slow down, these other thoughts and feelings begin to emerge. And that's what I was addressing in that episode. Does that sound familiar? Or did I do an okay recap of that from what you remember from the episode?
Yeah, definitely. I think I remember in the specific example of that episode, like you mentioned, kind of filling your itinerary or schedule with a whole plethora of tasks to help keep you distracted from what's really lingering, like underneath the surface. Of course, that's not very realistic because there's always going to be downtime. There's always going to be moments when those slow down. And then when those feelings emerge, you don't really have the tools to deal with or evaluate it. Exactly.
Yeah, that's a good point. Let me sort of digress just for a moment into that as well, because one thing that often comes along with thinking in extremes is quick oscillations. So in other words, when things slow down, which inevitably they do, even with a busy work schedule, because the day comes to an end at some point, with if I could call this a defense mechanism, right? Splitting as a defense mechanism. The problem with this one is it oscillates so quickly. So you could go from feeling really good and excited, right, to feeling despair or completely down and depressed. And these moods shift quickly. And I'll just fast forward just for a moment because, and maybe we'll get into this later as you and I are talking, but there was another episode that I did later on in terms of black and white thinking, which is in essence what you and I are discussing today. And one thing that I mentioned is somebody could be really excited about a date, for instance, and really looking forward to the date, but then the date arrives late and suddenly the whole mood shifts so rapidly. And in that later episode, I was actually being interviewed by this young woman who made this correlation with borderline personality disorder. And I had mentioned that was an astute observation because with the border, and this is with the narcissist also, that with both of these personality disorders, there is a fragmented sense of self. And fragmented, another way of saying fragmented is what? A split. So there is a split sense of self. But the main difference between the two diagnoses is with the borderline personality disorder patient, what you typically see are very quick oscillations. I love you. You're the best. You're the greatest. And then your date's eyes look somewhere else. I hate you. How could you betray me like this? And these oscillations happen very quickly. Now, to some extent, this happens with the narcissist too, but you don't see the quick oscillations because, and I won't go into this now, maybe later we'll get into it, but because they have what's called the grandiose sense of self, it's kind of like this grandiose, omnipotent structure that holds together that fragmentation a little bit more than what the borderline patient has, if that makes sense. So you don't see as the quick oscillations, but that does not mean that the fragment is still not there. It is there. And even with the narcissist, you still see this extreme way of thinking once there's what we might call some kind of narcissistic slight, something that stirs up some sort of conflict in them, and then they can oscillate at that moment.
Yeah, that makes sense. It actually does relate to the real life example I have.
Yeah, let's get into it. What were you thinking?
Yeah, so as I mentioned previously, I'm working with someone by the alias Tony. He has two main environments that take up most of his day-to-day life, which is at home and at school. And both environments have a very different kind of essence to them. Home is associated more with negativity, whereas at school, it's associated with more positive feelings. At home, he's experiencing a lot of belittlement and criticism from one of the members in his household. And then at school, he's experiencing a lot of praise. His fellow classmates feel almost intimidated by him because of how successful he is in his courses.
Okay, so this is wonderful because it fits right in, because this is a podcast on narcissism.
Right.
Now, if we're thinking psychodynamically about a case and we just wanted to play around with this, what we could speculate is this is a fantasy that he has at school.
Okay.
You might argue with me that he's told you many stories that suggest that this is true, that his classmates really do see him in this way, and there may be a grain of truth to it. But the more important piece is his psychic experience, like his inner experience of this, and to what extent he is constructing this reality. Because if we can call it a fantasy, in the fantasy, then what we begin to see is, this is the grandiosity that I just mentioned in the introduction when I was doing the review, of the prior podcast. This is his own omnipotence. This is his own grandiosity, because in his mind, if you tease this apart and you get really close to it, which is what I always recommend doing when you're trying to relate to somebody like this in your life, my guess is what you would begin to hear is there's a whole fantasy that goes on, and how special or how different, how talented, how intelligent he feels, and how he feels so above everybody at school because he's so special.
Right. Yeah, for sure. Yeah, I think it definitely feeds his ego and, like you said, grandiose sense of self. Yeah, at school he feels very safe, very secure, very confident, very empowered. There's not much at school that can deter him from feeling that way. It's when he goes home where that completely dissolves and dissipates. And he almost forgets that kind of high that he felt at school. Once he comes home, he's back to zero, level zero confidence.
Why? What happens at home? Do you know any of the details of what goes through his mind when he gets home?
Yes. So he actually lives with two authoritarian figures at home. He lives with his grandmother and his mother. Both are very different, where his grandmother is a very powerful and almost domineering character. She's very criticizing towards him and his mother because they've lived with this grandmother. She's kind of the head of the household. They see her as mainly the source of power.
Okay, wait, hold on.
Yes.
Let's think about, again, because this is all so important, and we want to, again, for anybody who's listened to the podcast, and maybe Celeste, you've heard me say this as well, is we want to always slow these things down, because this is a lot of information, and we want to begin to imagine what sort of impact having a grandmother like that in his life has on his own inner world. Because you may have heard me use a concept such as internalization. I don't know if you've heard that before, but in short, basically what it means is these early caregivers in our lives, they sort of seep into us like osmosis. And even if we think we separate from them, and healthier individuals do, by the way, separate from them, but with personality disordered patients, they don't have that level of separation, so they tend to carry this stuff around with them. In other words, it's not put to rest. So with this fellow, he lived with his grandmother from about what age do you know when they started living with the grandmother? Because I'm just trying to think what sort of impactful influence she may or may not have had on his own inner world.
Right. Yeah. He's lived with her since he was born. So he's about college age. Yeah. So.
Okay. And then again, for the listeners and for me too, can you tell us, say it again, how does he describe his grandmother?
So he describes her as very domineering and powerful and criticizing.
Criticizing. Okay. So when anybody hears something, like whether it's a loved one, I know a lot of professionals are listening to the podcast, but if this is a patient of yours, like with Celeste, what you want to begin to immediately begin to think in your mind, not to the person, because you're not analyzing them unless you're the therapist, right? But if this is a significant person or loved one in your life, you do this in order to understand them, and understanding fosters empathy. So what do you already start to speculate? I'm going to give you a little bit of space here, okay? Celeste, do you have any speculations just from this little piece of information about the way he describes his grandmother?
Yeah, so I'm getting the sense that he's holding her to a very high regard because of how much she puts her opinion onto him. He sees that opinion as being something that's very, very not valuable, but very significant. So any decision he makes or any kind of move he makes, whether it directly affects her or not, she's going to have something to say about it. So he definitely feels like he's under a magnifying glass that she's holding.
Okay. Okay. So you may have noticed this, but let me just point this out just in case you didn't notice it.
Mm-hmm.
But you're describing this as if this is really his grandmother. Like anything he does, she's going to be watching. And it's what I said earlier. Remember what I said earlier, the people at school.
Mm-hmm.
We want to begin to think of these things as like sort of straddled between reality and psychic reality. So in other words, yes, there may be classmates at school who really do idealize him, but some of that is also constructed in his mind. The same thing with his grandmother. It is probably true. There's some reality to this, that he has a grandmother who's very critical and sets a very high ideal, right?
Right.
But he continues to carry this around. This is the whole concept of internalization. So this becomes part of his own psychic structure. So what does that mean? That means now that he walks around in his everyday life with a very high ideal. And just to use a little bit of psychoanalytic jargon, if you could bear with me for a second, this is what we call the ego ideal, right? So he has a very high ego ideal. And what happens, or I should say, what happens when one does not meet that ideal, which they don't, by the way, because it's so high, it's impossible, because it gets exaggerated for many different reasons, but I won't go down that rabbit hole just yet. But it gets exaggerated. So when he doesn't meet that ideal, what happens? Now, he will say, my grandmother criticizes me or judges me. But you have to keep in mind that this is his internal representation that he carries around inside of him. So he too judges himself and will be hard on himself.
Right.
Does that make sense, or
That makes sense.
am I using too much jargon?
No, it makes sense. So realistically, of course, his grandmother does not have like an eye on him at all times. You know, he goes to school, he's able to conceal some things or some decisions that maybe he doesn't want her to know about. He could realistically do that, but in his mind, he's just constantly thinking she's going to find out anyway. She's always has an eye on me. She just has this like secret sense of what I'm doing. So
he says this, is that right? This is something he may report?
Right.
Okay. Because again, bear with me, but I just want to use one other piece of psychoanalytic jargon.
Yes. Please.
We also have something in theory. I mentioned the word internalization. I mentioned ego ideal, but there's something that's also called the superego. I don't know if you've ever heard of that concept before.
Yes.
But the superego is like the watcher. This is what watches over us. It's complicated. And again, I won't get into it, but in part, this is our morals and values. Are we matching up? Are we meeting up to these morals and values? And if we don't, how critical, how harsh is that superego? Like, how angry is it going to get with us? And then what do we do with that anger? Because remember, it's not the grandmother at this moment, but it's part of us who's getting angry. So you could imagine already, I know you didn't mention anything about anger yet, but I'm already introducing this idea into this formulation of what's going on with this fellow, is that there's probably some anger there as well.
Definitely, for sure.
Yeah. Because you've heard it, or it resonates in some way when I say that, or?
Yeah, even when he's just speaking about it, he might not directly admit that he's angry, but tone of voice, the signs are there that he's very frustrated with the situation at hand. So
yeah,
that resonates.
Now that part about not admitting is really important, because this whole discussion that you and I are having started with an episode about splitting, right? Black and white thinking, that's also called splitting. So I'm always thinking, even though we're talking theory right now and I'm introducing some concepts, I'm always thinking about how do you get closer to somebody like this? Again, for listeners who have a loved one in their life, the goal is to get closer to somebody like this or to leave them. But I don't usually advocate leaving initially, at least, until you figure out if you're invested in a relationship and you don't want to just leave them. It has to get a little more complicated. And part of it getting more complicated is getting closer to this stuff. So we're talking theory, but I'm already thinking about how do we get closer to somebody like this? Or in your case, Celeste, treatment interventions or techniques or tools. What do you do? So we're mentioning this embedded in an episode on splitting, but you just said, like, you can hear the anger, but he's not aware of it. So then we could say, kind of like, again, going back to where we started, it's very possible that the anger is split off, unknown to him. Doesn't mean it goes away. It just comes out in different ways, right?
Yeah.
So one part of working with somebody who is splitting, the ultimate goal is what? Integration. Because if there's a fracture and it's creating a problem, we want to integrate it, right? That's part of the healing process.
Right.
But in order to do that, we have to begin to slowly introduce them to aspects of themselves that are split off, because that's part of integrating, right? So that it's not just there's hate or anger over here and there's magnificence and omnipotence over here, but we have to bring these things together into a more complicated whole so that we don't have two parts, like two halves, like a split. I don't know. Am I doing okay in terms of explaining this, or does this make sense? I'm just checking in with you in case I get too far away from it.
No, yes, this makes sense. This makes perfect sense.
Okay,
yeah, I definitely think internalized and needed to be integrated to help him fully realize.
Yes.
For sure.
It's like these polarized. So, go ahead, you finished. So he gets home.
Right.
Let's go a little bit more into I know I keep stopping you. Maybe you could go back to where, sorry about that, but we could go back to where I interrupted last and we could talk a little bit more about the case.
Yeah, so he has the two figures in his home life, one being his grandmother, as we discussed, and also his mother. So his mother is almost an opposite of the grandmother.
Oh, she's the old good one?
Yeah. Yeah,
Oh,
she's
so-
very, yeah, the mother, compared to the grandmother.
But you see why I'm laughing? You see what it is?
Maybe.
Why am I laughing at that when I said she's the good one?
Well, usually the mother is closer to, like, the son in this case than the grandmother. And especially if the mother's, like, the opposite, where she's, like, the good one, so to speak, Tony might feel more comfortable in himself if he would just align with her ideal rather than the grandmother's ideas.
Okay. So I'm having this thought, and you could help me with this a little bit.
Okay.
But the reason I kind of laughed at it is because to me, immediately it felt like another example of splitting.
Oh, right.
Right? That the grandmother's the critical evil one and the mother's more benign or benevolent and like a good figure. Right? And you can see there's no amalgamation. There's no mixing of the two. It's the split world again. It's the dichotomy. Maybe. Again, I'm just listening to this for 15 minutes now or so.
Right.
So I can't say this for sure, but I'm just sharing with you what starts going through my mind and how pervasive this splitting, if in fact this is a fellow who splits, which we have some evidence that this is happening, just how pervasive this is in his life. It's not just at school now, you see.
Right.
It's not between school and home, but now it's between mom and grandma.
Right.
Okay.
There's multiple levels.
Yes. Yeah. And it makes sense because, again, I just digress for a second. One of the things that distinguishes a personality disordered person from like your garden variety neurotic person, like who's a little higher functioning, is we all have these characteristics, that make up narcissism, or I mentioned borderline personality. We all have some of these characteristics, but the question is, how pervasive are they? How many different areas in our life do they cut across or do they infiltrate? And we could see with him, it goes with him to school and then it comes home. And then the only other question is, does it happen in intimate relationships? I don't know if you know anything about his relationships. So that's the other area to explore.
Right.
And why is this so important? Because if you're treating somebody like this, or if you have somebody like this in your life who's a loved one, you can almost guarantee that this is going to happen with you as well at some point. It's just part of the way they think. It's part of their personality.
That makes sense. Yes.
Yeah.
It cuts across, like you said, many different facets of their life. So his mother, she actually encouraged him, because what he's studying in school and college is art, and he is, as we mentioned, very passionate about it. He feels confident in his artistic abilities because at school, that's where he feels most comfortable. So she encouraged him to follow the passion. So he feels safe in that with her. But then the grandmother, of course, has to disagree with it, art specifically. So it's interesting because his mother is very encouraging. She's the one who's kind of pushing him to pursue his dreams. But then again, the grandmother's very disapproving. He doesn't even almost take his mother's advice or her view of him as truth. He kind of disregards it and takes the grandmother's view as truth, which is interesting.
That's very interesting. You would think on the surface that if somebody's more supportive, like the way you're describing with his mother,
right,
a bit more understanding, like encouraging, that is something that he would identify with.
right.
But you're saying that that's not the case. He is still identifying more with his grandmother.
Mm-hmm. Yeah.
And in what way, like, how does he, this could be a whole nother avenue, because what you're touching on now, Celeste, and this is really a difficult paradox to think about and deal with, but it's like, if somebody has something positive in their life, doesn't necessarily mean that that's what's going to get taken in. Do you see what I mean by that?
Right.
In social media, there are a lot of different perspectives on narcissism and personality disorders. And one perspective, I hear this quite frequently in terms of treatment. And what would be helpful is like embracing a more positive mindset. And I'm oversimplifying it a little bit. This is an oversimplification, but it looks something like this. Why are you so negative? Just be positive. Why do you always focus on negativity? Just focus on things that are beneficial or positive. But this case is an example of it. And this is why many of these self-help books do not work. And I know they don't work because I have patients in the community who have been following the social media for years, and they come to me very frustrated that they're not getting better, that nothing changes. But you can't just will yourself to think positively or to take in positive experiences. And then the question becomes, why? Why can he not identify with his mother in this situation and push aside the critical grandmother's voice, right?
Right.
So let me ask you this. Usually my podcast episodes are about 30 minutes, and we're kind of at that point right now. But I feel like really invested in this case, and I want to keep talking about. Do you think there's any chance we could continue this discussion? I imagine you have more to say as well. Is that right? Do you think we have enough to maybe push this to a part 2 of this?
Yeah, I think so. I have, different dynamics to discuss, also different questions for sure. So.
Okay, good. So let's do that. Let's begin to wrap it up here with this really fundamental question that we want to come back to. We spoke about splitting. We're speculating again, because it's still early days. I'll get to know this fellow a little bit more as we talk next time.
Mm-hmm.
But we're speculating that it's following him in different aspects of his life. And then we bumped into something very complicated, which is there is an opportunity to have something more beneficial, to identify with a more forgiving, supportive voice, but he does not do that. And that's the question I'm leaving you with, Celeste, and our listeners, is why is it that something that we want so much, right, on the surface is like, yeah, this seems like would be really nice to have a supportive, encouraging voice. But why is it we cannot hear that, and why do we need to push it away? So that's where we'll start next time, okay, when we pick up. But before we sign off, I just want to say to the listeners that I want to thank everybody for using this new function that we discovered recently called fan mail. Now, people have been sending me questions and leaving me comments, which, by the way, I love, and I encourage you to keep doing that. But for whatever reason, I cannot respond to your messages through fan mail. So if you want me to respond, we have to go back to the old school way of just sending me an email. And you've heard me say this, I wrap up every episode in this way, which is if Celeste and I this time said anything that confused you, or there's anything more that you want to know about this splitting, if we don't cover it in this or the next episode, feel free to shoot me an email. I always respond to them. And like with Jim in our last episode and Celeste now, you'll see that I may even invite you to come on and talk about these questions, because if it's on your mind, if these questions are on your mind, most likely they're on the minds of many people. So let's leave it there for now. Until next time, engage your mind. Okay, bye for now. Thanks again, Celeste. I'll see you next week.
Thank you. See you
Okay,
next week.
bye. Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.